Lesson 9.1 Pregnancy. In order for human sexual reproduction to occur naturally, the sperm must fuse and fertilize the ovum and the fallopian tube in a very narrow 24-hour window of time immediately following ovulation. Most pregnancies occur when sexual intercourse occurs a few days prior to ovulation, which allows the sperm time to travel from the vagina, past the cervix, into the uterus and up the distal portion of one of the two fallopian tubes. Sperm can remain viable in a woman for up to 5 days, and of the 100 million sperm found in ejaculate, only about 1,000 will travel up the correct fallopian tube to find the secondary oocyte. The fused ovum, now called a zygote, will divide methodically as it travels down the fallopian tube into a blastocyst, consisting of 200 to 300 cells. Once the blastocyst arrives at the uterus, the uterine wall should be thick and ready for implantation. If the egg is unfertilized or not properly developed, it will be expelled out of the body during menstruation. Implantation will result in the embryo secreting a hormone called human chorionic gonadotropin, or HCG, which promotes the corpus luteum in the ovary to produce elevated levels of estrogen and progesterone. In the first trimester, an amniotic sac forms around the developing embryo and a placenta will form. These will be used to nourish the fetus's blood by exchanging gases and nutrients with the mother's blood via the umbilical cord. By the end of the first trimester, the 4-inch long fetus is fully formed with limbs and organs present. The second trimester sees the fetus continue to develop and grow, and facial features begin to appear. The fetus's movement is detectable and will grow to 12 inches long. Third trimester is where the fetus shows most weight gain, growing to 18 to 20 inches. The placenta and ovaries will release a hormone called relaxin throughout the pregnancy, which softens the muscles and ligaments of the pelvis to accommodate for the developing fetus and in preparation for birth. At around 256 days or 9 months, the pressure of the growing fetus on the pelvic floor triggers the placenta to stop producing progesterone, which among other things was preventing uterine contractions. Low progesterone then triggers the posterior pituitary gland to secrete the hormone oxytocin. Oxytocin initiates and maintains strong uterine contractions. Oxytocin positively feeds back to the posterior pituitary gland, causing the cervix to ripen, thinning and dilating to 10 centimeters wide. Contractions now occur every 5 minutes or so, lasting up to a minute at a time. After childbirth, the suckling action of the baby triggers more oxytocin secretion, which increases milk production in the breasts. Oxytocin also triggers contraction and shrinking of the uterus to limit blood loss due to bleeding. The placenta detaches from the uterine wall and is expelled. This is called the afterbirth, which triggers the release of prolactin from the anterior pituitary gland. Prolactin further promotes breast milk production for the next number of months of child breastfeeding. After childbirth, the mother's 28-day menstrual cycle will return back to normal. Menopause is a period in a woman's reproductive life where she is no longer reproductively viable. This is often due to her ovaries becoming insensitive to the hormones LH and FSH. Initially, the menstrual cycle becomes irregular. She experiences hot flashes, dizziness, headaches, insomnia, and possibly depression, which are byproducts of the large hormone levels circulating in the blood as the body tries to act on the unresponsive ovaries by producing more and more hormones. After a full year of no menstrual period, a woman is in a state of menopause. This usually occurs at the age of 45 to 55 years old.